It's my pleasure to have this opportunity to speak a little bit about digital emergency medicine. Specifically, how can technology be integrated into our specialty of emergency medicine? Can technology offer us that new capacity? That's what I'd like to explore with you in the next 20 minutes or so. This is an older paper in 2017 talking about telehealth, use of technology to deliver health services at a distance.
Digital emergency medicine is using technologies like mobile phones or computers to make us help patients better when they have emergencies. When I, in the past, do shopping, I go to a shopping mall. But now, my kids shopping, they go online. What I hope to do is when a person have emergencies and it's not life-threatening, that they would go online first and then get in touch with the emergency doctors and nurses. We help them at home right away to start, and if they only need to, they come to emergency. It will require 3 types of information. 1, if I can know the patient's past medical problems from their records, that helps me. 2, if through digital, I can talk with the patient and understand what they need today, and that's important. And the 3rd is if I can use digital technology to know what the person's blood pressure, heart rates, and all the physiologic data is. That's the 3rd set of data. With those 3 complete set of data, I can then help the patient much better in the distance when they're at home to help them to make sure that their emergency get addressed appropriately. I know in Canada, when we use this system, 7 out of 10 patients no longer need to come to emergency. I know that in Turkey, there's a wonderful emergency system. I look forward to the opportunity to work with our Turkish specialists in emergency medicine to see if we can replicate that. I love to work with them to see if this also can happen in Turkey to reduce 7 out of 10 people from needing to come to emergency department. In Turkey, you have a big advantage that you have the e-pulse system to already have that electronic record. So to be able to work with your specialists to offer the just-in-time information for the patient would be easier. Because when we first started in British Columbia, in Canada, we didn't have that electronic system. We're starting to build towards it. And so the collaboration will help each of us in Turkey, in Canada, to accelerate the system. In Canada, we have a 811 number that patients can call. This has been going on for more than 10 years. But because of COVID, we as a group physicians are invited to work with nurses together so that we start with telephone, but we can go onto video to see our patients. And we find that with this collaboration with the nurses to support our patients, that we have seen more than 100,000 patients now over the past 2 years. 7 out of 10 patients, we no longer need to send them to emergency departments. And also, 1 out of 3 patients, after we've seen them, they don't need to see a doctor anymore unless there are changes. And we found that that was very helpful to our health system so that the emergency department has decreased crowding because we don't send as many patients there. And also we can use our primary care doctors also to support and follow up the patients. And most importantly, we can help the patients to manage themselves and also make them feel less anxious and to know what they need to do and be prepared for it.
A new parent with their child. For the first time, the child has fever. These are everyday emergencies that happens in patients' homes, but because they have no other choices except to show up in emergency.